Alright, in this video I want to walk you through what to expect on the day of sinus surgery. Most sinus surgery is done in an operating room, either at a surgery center or in a hospital. Typically, you'll arrive the day of surgery with a family member or friend. After you check in, a nurse will greet you, review your health history, take your vital signs, and ask a few routine questions. You'll get changed into a gown, and then they'll place an IV in preparation for surgery. Your surgeon will come visit with you to review the surgical plan and answer any questions. The anesthesia provider will also meet with you to go over anesthesia. They'll discuss typical risks, what to expect as you wake up, and they'll answer any questions you have. Then you'll be taken back to the operating room. You'll move yourself over to the operating table, get comfortable, and you'll breathe some oxygen. The anesthesia provider will then give medication through your IV, and you'll fall asleep. Once you're asleep, the anesthesia provider protects your airway by placing a breathing tube through your vocal cords. That tube has a small balloon that inflates just below the vocal cords to seal the airway and help keep any blood or irrigation fluid from going down the wrong pipe. That's one of the key safety steps during sinus surgery. After your airway is protected, you're prepped and draped with sterile towels and drapes, and the procedure begins. Depending on your specific problem, different sinuses will be addressed. You have 4 sinuses on each side, and each one can be treated a little differently. The length of surgery typically depends on the number of sinuses being addressed. In some cases, your surgeon may also use image guidance during the procedure. After surgery is done, the anesthetic medications are stopped and you are allowed to wake up. As you're waking up, the anesthesia provider will remove the breathing tube once they feel you're safe and breathing well on your own. After sinus surgery, it's very common to have some gauze taped underneath your nose. This is to collect mild bleeding and drainage that are expected right after surgery. It helps to know this ahead of time because when people are coming out of anesthesia, they can be a little confused and instinctively want to grab at their nose. If you already know the gauze will be there, it's much less surprising. From there, you'll be taken to the recovery area where the nurses will monitor you as the anesthesia continues to wear off. While you're in recovery, your surgeon will talk with your family to let them know how things went. They will review instructions, go over their preferences for managing bleeding, and discuss when to start rinses or sprays. They'll also review the medications you'll be using. Typically about 20 to 30 minutes after the procedure, you're awake enough for family to come back and sit with you. Once you're awake, comfortable, and you've gone over the instructions with the nursing staff, you're ready to go home. For pain control afterwards, most patients can use non-opioid medications like Tylenol and ibuprofen. Many surgeons will also prescribe a stronger pain medication to use if needed. And that's the typical flow for the day of sinus surgery. So now you know. If you have any questions, write them down and you can discuss with your surgeon before surgery. Thanks for watching.